most of the businesses are going to get affected because of this COVID-19 pandemic.
We will be taking mandatory COVID tests prior to undertaking kidney transplant.
This kind of health hazard anytime can affect in business efficiency, leading to reduced work quality and output.
So what did government do for this?
Welcome you to our YouTube channel Day to Day Life. We started year 2020 with the coronavirus epidemic, and this has affected many lives and businesses around the world. Sri Lankan government and many other parties taking the collective effort to control the situation, but we can still see the numbers are slowly going up. To give our viewers some understanding on the current and upcoming challenges the business entities have to face, we invited a few leading personalities from different business areas to share their views on the impact of COVID-19 on the economy of our country.
Let's look at the COVID-19 and the impact to the Sri Lanka economy. Initially, when year started, 2020, Central Bank released a statement on expected growth rate of GDP of about 4.5%. But however, due to COVID-19 impact, the EDB came and mentioned that their expectation is going to be 2.2%. And thereafter, PwC, when they released the statement that from their research report, they mentioned that the expectation of Sri Lanka growth rate will be less than 2%. And overall, when you look at the COVID-19 impact, the main sector that will be getting affected is the tourism industry.
I would like to share a few words about the COVID-19 pandemic and its impact on Western Hospital and our affiliated CSR strategy as a result.
When concluding to the COVID-19, we can see that many businesses worldwide are left with no options but to give leaves to their employees owing to taking safety precautions against coronavirus. This is somehow hampering our work productivity and work deliverable as well. This kind of health hazard anytime can affect in business efficiency, leading to reduced work quality and output.
Our local tourists also is not going to come, and also from Europe and all other countries, people will not come. So tourism industry is one of the industries that's going to get affected in a large scale. From the total exports, around 30 to 40% is from the apparel industry. So roughly there was a number that came up with roughly about 80 to 100,000 jobs are at a risk in the apparel industry as well.
We have seen huge revenue drops in Western Hospital. There's been closure of certain essential services in Western Hospital. Fear and hysteria has increased among staff and patients alike. There has been logistical problems for staff to come to work, and even for patients who require life-saving treatment, they also don't have methods of access to the hospital.
Initially, when the year started, Export Development Board had an estimate for 2020 of 18.5 billion exports dollars, $18.5 billion worth exports as a target. But however, due to this pandemic that has taken place, that they have revised the target to 10.75 billion US dollars. But however, due to this coronavirus pandemic, there are some industries from the export point of view which is benefiting, which is like the tea industry and seafood and fruits kind of thing. Those kind of industries are benefiting because of the higher consumption, because people are indoors, so they consume stuff. So consumer driven products, there is a demand.
Companies that considered now outsourcing their work to reputed company were able to surpass these problematic situations by being in the safe zone and safe hands.
So what did government do? They had few discussions with several officials from different industries, and they decided to give some concessions. So one of that is giving the debt moratorium of 6 months. So where a business which has to pay their loans and all, business loans which they can hold on for 6 months, and then thereafter they start paying it off.
In terms of its internal publics, especially employees, we have provided them a variety of personal protective equipment, including gloves, masks, goggles, aprons, and so on, other personal protective equipment.
This makes it evident to outsource the other companies' back office workload to the outsourcing providers to ensure smooth business operations during this health business battle, which started as a result of this coronavirus.
Also, to safeguard both the external and internal publics, we have developed a triad systems before people enter the hospital. We have also developed isolation rooms. We have educated our staff on social distancing, hand hygiene, and so on. Patients who are coming from high-risk zones, if they are going to take any sort of surgical treatment or other types of treatment, we have made it mandatory to do a COVID-19 test, especially if it is a surgical procedure.
And also for working capital requirements. Working capital requirements are there for day-to-day salaries, wages, and to running business kind of things. So for that, the money that is being needed, government also has made arrangements to pump in money into the system where the businesses will be able to survive. Let's look at what is going to happen to the exchange rate. You would have seen the exchange rate was around 170, 180, and as COVID-19 impact hit Sri Lanka as well as globally, Sri Lanka dollar, Sri Lanka rupee against the dollar have went up to around 200, but now it has come to around 193 level and settling.
We also developed new SOPs with the help of the ministry regulations, where mandatory temperature checks. Also, when patients enter the facility, we assess them based on a few questions that we mandatorily ask them. We have placed specialized staff at certain points to actually question these patients if they have COVID-19 based symptoms. And if they do have COVID-19 symptoms, we do transfer them to the IDH. We also started to concentrate more on mobile services because we didn't want people to gather in public too much. So we thought we'd go to their houses and provide them healthcare services.
So overall 2020 we are looking at a very slow economic growth, which we also could look at a recession. But however, government mentioned that they will open a separate special account called SDA account for foreigners, foreign remittances to come in and no questions asked. So whatever dollars that come in for a period of 3 months, no questions asked, you could bring the dollars because the government for every dollar is very important at this moment.
So if rapid testing comes, during the post-epidemic surveillance period, we are hoping to do more testing. If the vaccine is available, we are hoping to do the vaccinations in Western Hospital as well.
Finally, from the PICME BPO, we were dealing with global companies, and we were planning to launch our companies to the Sri Lankan market as well at the beginning of this year. But unfortunately, this pandemic situation has come up uncertain ways.
So overall, what we are looking at the economy to slow down, but I would advise you all to tighten up your belts and see where you could reduce cost from wherever come, rather than cutting from employees. See where we can reduce cost and focus on 2021 or 2022 rather than 2020. So stay calm and make sure that your strategies are being placed to fight this pandemic.
So thank you for listening to me. At present, I would like to say obey all the rules the government has set out for you. Support our frontline healthcare staff. Stay home and stay safe. Thank you very much.
Finally, we would like to say stay safe and please follow the government rules, and we support you to them to minimize this pandemic situation. Thank you.
So I'm Roshan Fernando. Thank you very much for inviting me for this show. Thank you.